Let's talk about chipmunk disease. For a lot of younger parents, mumps is one of those diseases that you've heard about, but never actually seen. I'm probably one of the only people in my practice that's actually seen a case before. That's because vaccines have made it much less common than it used to be. Before the mumps vaccine, the United States would see about 200,000 cases every year. While it didn't cause a huge number of deaths, it certainly caused a lot of misery and some very serious complications. Mumps is a virus. Again, it's spread through respiratory droplets, meaning coughing, sneezing, close contact. After exposure, your symptoms usually begin 2 or 3 weeks afterwards. The classic symptoms of mumps are swelling of the salivary glands, particularly the parotid glands that live right in here. They're located near the jaw. This gives the children that characteristic chipmunk cheek appearance that many parents associate with mumps. But mumps is much more than swollen cheeks. If that was all it was, we wouldn't worry about it. Children also would develop high fever, fatigue, headache, muscle aches, loss of appetite, and just feeling bad. For many kids, it can mean missing school and feeling miserable for a week or more. The disease became much more concerning in older children, especially teens and young adults. In post-pubertal boys, mumps could cause an inflammation of the testicles. It's called orchitis. It was extremely painful, and it can occasionally kill off the testicle, which would cause it to shrink. While infertility was uncommon, it was a potential complication if it managed to get both sides. In post-pubertal girls, mumps could cause inflammation of the ovaries or breast tissue. These complications were usually temporary, but could be quite uncomfortable. Measles could occasionally cause meningitis, encephalitis, hearing loss, and inflammation of the pancreas. But fortunately, vaccines completely changed all that. The story changed dramatically. The mumps vaccine was given as part of the MMR vaccine, measles, mumps, and rubella. They can typically receive the first dose between 12 and 15 months of age, and the second dose between 4 and 6 of age, right before they go to kindergarten. The vaccine has been highly effective, though not perfect. That's why we still occasionally will see outbreaks, especially in places where lots of people live, work, study closely together, such as schools, college dormitories, camps, and military barracks. In these places, older children can sometimes, and young adults can lose some of their immunity. Most vaccine side effects are mild and short-lived. Children may develop a little soreness at the injection site, low-grade fever, mild achiness for a day or two. Because the MMR is a live vaccine, it should not be given to individuals who are severely immunocompromised or have had a previous serious reaction to one of its components. The good news is most parents today have never seen a case of mumps and probably won't. The reason being simple: vaccination has made what was once a common childhood illness a relatively uncommon